Analytical method validation for cleaning. Presented by Learn GMP Incorporated in collaboration with Technical Training and Consultation Service LLC. Introduction and key objectives. Validating an analytical method for cleaning validation ensures that your laboratory can reliably detect trace residues of APIs, detergents, and microbes on cleaned equipment surfaces. This is critical for demonstrating GMP compliance and protecting patient safety. Key objectives. Detect trace amounts of residual product, cleaning agent, or microbial contamination. Ensure specificity, sensitivity, and accuracy at or below the MACO maximum allowable carryover level. Comply with regulatory expectations, for examples. ICH-Q2, R1, USP less than 1,225, FDA, EMA. Analytical techniques commonly used. For API, HPLC, UV-Vis, or GC. For detection of detergent, TOC, conductivity, and UV. For microbial, bioburden and swab plating, and for nonspecific testing, TOC and gravimetric analysis. Parameters to validate. Per ICH-Q2 and GMP guidance. Parameter, specificity. Description. Ability to detect only the target residue in the presence of other materials. Typical expectation. No interference from swab, solvent, etc. Parameter. Limit of detection, LOD. Description. Lowest amount detectable, not necessarily quantifiable. Typical expectation. LOD, MACO or acceptable limit. Parameter. Limit of quantitation, LOQ. Description. Lowest amount that can be accurately quantified. Typical expectation. LOQ MACO. Ideally less than or equal to 50% of MACO. Parameter. Linearity. Description. Proportional response across a range of concentrations. Typical expectation. R superscript 2 greater than or equal to 0.99 in the range covering LOQ to 150% MACO. Parameter. Accuracy, recovery. Description. How close measured value is to the actual value. Typical expectation. 80 to 120% recovery. Spiked samples. Parameter. Precision. Description. Repeatability. Intraday. And intermediate precision. Interday/operator. Typical expectation. RSD less than or equal to 5% for low-level residues. Parameter. Robustness. Description. Resistance to small changes in method conditions. Typical expectation. Optional but recommended. Parameter. System suitability. Description. Verify system performance before sample analysis. Typical expectation. As per SOP, for examples, resolution, tailing factor. Validation procedure example. For HPLC method. 1. Specificity. Analyze blank swab, rinse solvent, and spiked samples. Confirm no interference at the API retention time. 2. LOD/LOQ. Use signal-to-noise ratio or standard deviation/slope method. LOD. S/n greater than or equal to 3. LOQ. S/n greater than or equal to 10. 3. Linearity. Prepare standards at LOQ 50%, 100%, 150% of MACO level. Plot concentration versus peak area. Calculate R². Correlation coefficient. Accuracy, recovery. Spike known quantity of API onto stainless steel surface. For example, 25 square centimeters. Swab and extract. Calculate % recovery equals measured/spiked times 100. 5. Precision. Perform recovery from identical spiked surfaces 6 times. Calculate mean SD and % RSD. TOC, Total Organic Carbon Validation Special Case. When used for multiple product detection, detergent residue detection, validation must include nonspecific response validation, lowest quantifiable carbon concentration, spike recovery on stainless steel or glass, blank TOC levels from water and swabs, TOC method must have LOQ lower than the carbon equivalent of MACO. Swab recovery study, required, for all surface sampling methods. Spike a known amount of API/detergent on surface, usually SS316. Dry, then swab as per SOP. Analyze and calculate percent recovery. Acceptance. Greater than or equal to 70%, preferably greater than or equal to 85%. Documentation must include validation protocol, raw data and chromatograms, validation report, certificate of method validation, swab recovery report, regulatory references, ICHQ2, USP less than 1,225, less than 1,086, FDA Cleaning Validation Guide, EMA Annex 15, WHO TRS 937 Annex 4. Thanks for watching our channel. Feel free to reach us at contact@learngmp.com for any training and consultation requirements.